Dr. Kalapp, it's so nice to see you. How are you doing today?
I'm doing great, man. It's good to see you, Dr. Noel.
Yeah, good to see you too. And it's always good to see you, especially in person. But this will do for today. I do want to ask you a few questions just as we start for the audience to
Sure.
understand exactly who you are, what your specialty is. You've been in practice for, I believe, 28 years, and you're a chiropractor, but you also have a advanced certification in chiropractic neurology, which is recognized as functional neurology. You're a teacher, you're a mentor, coach, you do all of those things for other clinicians.
I'm a diplomate in neurology, but I also have a master's in clinical neuroscience. But I've been fortunate enough to be around a lot of practices that really taught me how to be a good practice management person. So I mentor a lot of offices and kind of give them advice on how to be more efficient in their practice or what other modalities can we do to make more money and what's really effective with the patients. And not just functional neurology. I have a lot of clients that are not neurologists, so a lot of times these places will come to me and they say, hey, look, what's out there that's going to make us a really good living and we don't really have to work as hard. And so one of the things that always pops into mind is the decompression. And I
Mm.
really cannot say enough about decompression therapy because I literally did decompression. Now, I sold my practice 2 years ago, so I don't personally do decompression anymore. I'm not even really practicing so much, I'm more consulting. But we did decompression for 20 years. And I've seen, gosh, thousands and thousands of patients. So I think if I'm, with all humility, I think if I'm good with anything and I could take pride in saying I consider myself an expert, it is in decompression just because I did it so long. And my offices that implement decompression, man, they do really well. And it's something that the public is starting to recognize. I remember when we first started it, things have changed a lot. 20 years ago, the protocols were totally different. But, and I'll get into it if you want me to. How has it changed and all that?
I so appreciate that you are an expert in brain care, neurological care, as well as structural care, because that is my love and passion.
Sure.
Like you, I haven't practiced as long as you have. I've practiced 23 years, but I've always had access to spinal decompression in my office, and I could not imagine not having it. I did run into some challenges along the way, and that's why I ended up creating a home version, which does not replace the need for clinical care. But it is a tremendous tool, I think, to have because, and the problem I had, and the reason why I bring this up is that I had some patients that just couldn't commit to the frequency of care that was required, or they were out of that initial acute phase. They needed something that they could carry on past getting care in the clinic. They needed something to continue on, decompression at home in order to continue the healing process beyond what they were able to do in the office. And I say beyond what they're able to do in the office. It's not that we can do it for them in the office, but they wouldn't come at the same level of frequency if they had to come into the office. And at that point, it was actually okay for them to take on home care. They were in a place within their healing process where it was appropriate. But I just didn't have great options back then. This is 15 years ago that I was looking for other options. And so I would recommend inversion, and that would work for some, not work for others. A lot of people had some issues or some contraindications with it. And so we needed another option. What are the types of conditions that you've had success with decompression? What are some cases, I think, that you would say would be appropriate for a home option? And if you can maybe start there and talk a little bit about
Sure.
inversion versus decompression, that'd be really helpful.
Yeah. So we'd have patients that would come in, and first of all, I'm in Southern California. And when I was first doing decompression, I worked for we were a MDDC clinic, and we decided to get into decompression. So we went out and spent literally, we bought spine meds and we bought six of them. They were 120 grand a piece. So, and we were doing a lot of advertising on the radio, TV. So I kind of became a little bit of a personality locally in Orange County, and people would stop me and say, "Oh, I saw you on TV and stuff." But what I noticed that it was really good at is discs. So if you have different types of discs, it's going to be really good for that. Now, understand a lot of the doctors don't realize there are 5 types of disc problems. So I tell people if you have any kind of bulge or herniation, it's going to do great. Probably the number one thing that I've treated is protrusions. Yeah, as a protrusion gets worse, remember with the protrusion, you still have some of the fibers holding on, but then basically when you're dealing with the bulge, all you're having is the outer fibers just bulging out, and there's some kind of internal derangement with the fibers, and it's not necessarily visible to the naked eye. So on an MRI, it's just going to see a bulge, and people are thinking no big deal. But because it's the outer 2/3 of the disc, they may or may not experience pain. Now, I think that a bulge is a piece of cake. It's like 99% you're going to be able to fix these people with decompression. Now, if the person looks at it and says, "Oh, it's just a bulge, no big deal," I try to explain to them, well, if you ignore it, because we live in gravity, it's going to get worse, and now it's going to become a herniation. Now, remember, I'm using exact language. Doctors intermingle herniation, bulge, and all that stuff all the time, but I like to be very specific. So the best disc problem you can have is a bulge. As it gets worse, it turns to a herniation, and this is the way I explain it. So think of that outer bulge is actually goes in, because what happens is the tears in the fibers increases. So it's almost like the stream becomes a river, and what happens is it changes a pressure gradient. So that bulge will come in, but now the stream is now a river, and now you got disc material that's starting to go out. So that's the herniation. Again, decompression's excellent for fiber tears, like literally can repair those. All right. Now, as that gets worse, it's almost like you have a combination of the bulge and the herniation, and we call that a protrusion. So what a protrusion is you have the jelly that's now leaching out into the end of the disc, and now it's starting to bulge, and you got this big river of disc material. That is literally the number one thing that I've treated. Yeah, most people have protrusions. And then what I would do is when I would draw it, I would draw a line. I called it the Mendoza line. Mendoza line in baseball is if you hit below 200, you really kind of suck. So I tell people, look, it's important that we distinguish what kind of disc problem you have, because once you get worse than protrusion is what? Extrusion.
Mm-hmm.
And it's very rare that I would try to decompress extrusion, because extrusion, remember with the protrusion, I said the material comes out, it causes a bulge, but now extrusion, the material is now external. And you can't decompress that because it's literally like taking gum out of your kid's hair. The only way to do it is you've got to cut it out. Okay. So I have to tell them, and I tell them, look, if you cross this line, you're no longer a candidate for what I do. So my recommendation is you need to take care of this while the getting's good.
Yeah.
Now, as extrusion gets worse, then it's called what? Sequestration. And that's where all the disc material has oozed out, and now it's clumped together and made these big nodules. They get lodged in your spinal cord. Now we call it cauda equina syndrome. That's sequestration I've seen maybe 3 times in 28 years. And those people had surgery within 6 hours of me seeing them. Okay.
Yeah.
That's why I do like pre MRIs. And I'm going to tell you right now, back in the day when we first started, we did pre and post MRIs. So I know firsthand empirically what decompression does, because I saw the craziest discs in the world. Nowadays, do you need an MRI? No. No, I've made many judgments without an MRI. I do like to get an X-ray,
Mm-hmm.
because with decompression, you don't want to pull fractures. You just don't. Okay, pars fractures, all of that stuff, just don't even go there. So it's very safe for the elderly. My oldest patient was 95, and literally, it's not me, guys. It's just the stuff I've been taught. She went from literally a wheelchair to a walker. And it was fun because she was in a group home. And so she would have me come over for Christmas every year and stuff. And she passed away a few years back, but she felt like it got her life back. So
Mm-hmm.
the thing about decompression, it's very safe. And I do think what you've invented is kind of the missing link, because, when people finish the protocol, sometimes, people charge a lot of money. They don't want to spend more money in doing maintenance. But if you have something that they can take home and do it, oh my gosh, that's genius. And it's affordable. I mean, come on, who's not going to spend that amount of money to get an at-home unit that works? And they could have their friends do it if they want to. So another thing, so basically you don't decompress cancer, you don't decompress fracture, sprain strain or facet syndromes. Yeah, it works awesome. And I think a lot of pain is facet personally, but it's definitely going to rock facet syndrome. Definitely disc problems.
Mhm.
Yes, you can treat stenosis. And I've had dialogue with MDs or saying, man, you can't pull on stenosis. I go, why? They go, well, what's your explanation? I go, this is my explanation. What's stenosis? It's a canal that's now smaller. What's on the outside of the spine? You got all the venous system, right? So if it's all compressing, now you have venous ballottement. You have basically the venous system that's pulling blood, and that's creating what? Pressure. So when you're decompressing, what that's doing is it's allowing the venous ballottement to go away, and you're getting rid of that pressure. That alone is going to help the patient feel better because they don't have as much pressure in that stenotic canal. Yeah, so I
Yeah.
definitely would never be afraid of pulling somebody with stenosis or the elderly. And remember, when we say pulling, decompression is very gentle. Somebody explained to me once that you get more pressure in your spine stepping off a curb, stepping out of your car than you do getting the decompression. So I swear by decompression. And there were times when we first started, when we were doing the pre and post MRIs, we were charging $8,900 a case. That's for 24 visits. Okay. When I left that big practice to start my own practice, I was charging 4,800. Then after COVID, obviously COVID hit a lot of people financially. My sweet spot seemed to be $3,500. So people would look at and they go, okay, well, I'm doing 24 to 30 visits, $3,500. And I'm like, no, I do 16 visits. When we first started, we were doing 24 to 30 visits and people were coming in 5 times a week. Now, I found through years and years and years of doing this, I can see somebody twice a week, do 16 visits, and there's a good chance that they're going to feel fantastic, and even twice a week.
Mhm.
So it doesn't miss, because sometimes you'll have people that go, well, I can't commit to that many times a week. Now, this is one thing, and I teach my clients this. There are some people that come in and say, man, I'm just so busy. I can't do twice a week. I can only do once a week. You can treat somebody once a week. Are they going to get better? They should. It's just going to take longer. Now, another big question. Oh, well, I hang upside down. I do that and it seems to help. And I go, okay, well, then why are you here? If it's helping, I mean, why do you think you need to do this? Or why would I do traction? Or why? Because this is the thing in my area, we have Kaiser Permanente, and Kaiser says that they do decompression and they don't. They do traction. And well, that layperson's like, well, it's the same thing. And no, it's not. So what's the difference? This is the difference. And learn this because this is something that you can tell your patients and they're going to go, okay, that makes sense. So, and I haven't explained this in a while, so bear with me, but I said it a million times, so I should have it. So this is the difference between traction and decompression. Traction is a sustained pull, okay? And it's fine. It works for a lot of things, great for facet syndrome, but understand, and it's going to stretch that disc out, but it's not going to allow the mechanism to suck the disc back in. Remember, that's the genius with decompression. Okay. And just so you know, decompression was invented in the late 80s. I can't remember the doctor's name, but the first machine was called a VaxD. And a
Mhm.
VaxD is very old. I don't even know if they make them anymore. And then they used to have everybody prone.
Yeah, that's
Now I
what
find
I
that
started with that in practice.
yeah, exactly. And but now it's just gotten so much better. And what's nice is the equipment has now gotten a lot cheaper. You don't need to go out and spend 120 grand per machine. And now with your at-home thing, it's like, oh my gosh, now everybody can do it because it's so
Mm.
affordable. So this is how I would explain what's the difference between traction and decompression. And I say, okay, so what happens when we pull the spine apart? Your disc only has so much range of motion, okay? So when we pull and we hit that range of motion, everything will stop. We call that the physiological barrier of the disc. If we blow past the physiological barrier, no vacuum is going to be created in the disc. That's what traction is. The genius with decompression is going to pull the disc, and then once it hits the end range, it's going to pretty much stop and stay within the physiological barrier. When that happens, it's going to start oscillating. It's that oscillation that creates the vacuum in the disc, allowing everything to suck in. So that's why I tell people, because some people will call me and they'll say, look, I do decompression, I'm not getting results. And I go, you're probably pulling too heavy. With decompression, less is more. In other words, you just don't put people on 80 pounds. You start slow and you work your way up, like a pound a visit, maybe something. And
Yeah.
that's it. It depends on the patient. I would do on the machine I use. Remember, we had Spine Med, big, expensive. But then what I did when I opened up my own practice, I bought the
Yep.
Triton system, which is very inexpensive. And I just mastered that thing and I got great results. So, and I would start at like 40 pounds.
Yeah, I'm so glad you bring that up because I found the same thing. I have the same kind of machine that you just mentioned, the Triton
Mm-hmm.
Chattanooga machine. I've used VaxD. I've played around with other ones as well. I agree that more is not better. For a true disc problem, you want to get just to barely feel a light, gentle stretch, hold it for 40 seconds, release for 20 seconds, and do intervals like that. But it's just a you barely feel like you're being stretched. And that seems to be what yields the best outcome. There are some situations where people do decompress and afterwards like, oh my goodness, it really hurts now. And then they may wait a few minutes and then it feels better. I think those are great examples of going a little too high, pulling too much,
Sure.
taking it
Sure.
beyond those physiological therapeutic limits. And so I think it's important for people to recognize that, hey, if you're feeling like it's hurting a little bit more afterwards, it's likely because you did too much. Either you went too long, you're
Exactly.
holding that stretch too long. You need to make that intermittent cycle shorter. Those and go light, short, sweet. This is perfect. Just start small and build from there if you want to. And I
Yeah, I
also,
agree.
especially for home care, I think it's really good for people to it's ideal for them to see a clinician that can confirm that this is something that would be good for you. You got to be careful too, because not every clinician is experienced and trained in spinal decompression. So you may get recommendations of, yeah, stay away from that, and then, I have so many patients like that in my practice. I'm sure you've seen plenty who were told there's nothing else you can do. You have to have surgery or do nothing, just take medication and they make full recoveries. So,
Yeah.
but
Yeah. Good luck.
ideally, if you could see someone that is good, that maybe in your area was recommended by someone who is an expert in the spine and spinal decompression, who could say, yeah, this is great for you. That's really the best type of customer that in-home spine care can have, is someone who has a confirmation that decompression would be beneficial for them and they get cleared to do that at home. That's the ideal scenario. Yeah.
And it could be prophylactic as well, because personally, I think that every fire station in the country should have decompression technology in their facilities and their stations, because you may not have back pain, but I'll tell you right now, people with like big bellies, they need to do decompression because why? Their facets are just jamming. And everybody's got a different pain tolerance. If they're cortex, if they got a good brain, they're inhibiting the pain, but as they get older, it's going to come back with a vengeance. And then they're going to be 60. Well, I never even had a problem. Like, brother, you've had this belly for 40 years, man. Your facets have been jammed for a long time. It's just you didn't experience symptoms. It's like everything else, right? Oh, I didn't even know I was a diabetic. Yeah, you've been a diabetic for 20 years. And now that you have the symptoms, it's kind of too late.
Yeah, and people sit more, they sleep less. What
I
happens to
know.
your disc all day long is it compresses, it dehydrates through the day. And the shorter our sleep cycle is, the less of a chance we have to rehydrate our
Heal.
disc.
Exactly. And another thing that I've done, and I think, and I never shared this with you, Doc, but this is pretty genius on your part, is I had a friend in Louisiana that actually is pretty famous in the funk neuro world because he finished the neuro program through the Carrick Institute in 1 year and passed his boards. So he's like a freak. very intelligent. Okay. And I got to give him some props. Dr. Sean Chaudry in Louisiana, great guy. Um, and he told me once, gosh, probably 15 years ago, he goes, what's helping people get off the table better is they're actually doing E-stem while they're doing the decompression.
Mhm.
And I started doing that with neck and low back, and that helped. And I'm not saying that people would get up and would be hurting all the time, but that 1 or 2% that would happen. Now it never happened when I did that.
Mhm.
So what's interesting is your own unit, you've got that little device built into the unit. So it's like, wow, you're already thinking that. And I've known about that for 15 years. So I think
Yeah.
it's kind of cool. So you were
I'm
onto
so,
something.
I'm so glad you bring that up. I've probably overthought spinal decompression, more than most in our field. Um, and there's a reason why I put that in there. And there's a reason why I picked that specific device. It's just the frequencies at which it vibrates is
Sure.
phenomenal for
Yep.
tuning down pain, promoting healing, activating that parasympathetic function. It's phenomenal. Um, and and I agree with what you said. I love if I, for many years, was using a specific type of stim device during decompression. And you're right, it took out all that soreness. Vibration does that as well. It's just that it wasn't
Yes.
convenient to stuff a vibration device between the
Sure.
patient and the table. It wouldn't fit. You had to have something pretty thin. So, and that was not optional unless they're on their stomach. But what I do now, and this is something that's a really high price item, is I use high intensity PEMF. It's a
Nice.
pulsar that pulses magnetic energy. High intensity meaning you're feeling the energy go through and through your body, and it
Sure.
showers your body with electrons. This is again one other device that I'm pretty passionate about, and I'll talk more about it on another call, but it's phenomenal. And I do that with decompression. And now I do have some patients of mine that have purchased home decompression units who have gone out and purchased these 50,000 machines for home, that high intensity PMF
Yeah.
machine.
Yeah.
And they do like I do in my office, and they'll pulse, PMF their spine during decompression. That's how I do it in my office. We're doing PMF and decompression combined. And what PMF does is it turbocharges, it accelerates healing like nothing I've ever seen before, but it also takes pain down on the spot. It's
Good.
incredible. And so you can combine those things. And that's why, when we're trying to create a home unit, I was really trying to give it an affordable match that's highly effective. And I called the founder of the Resimax, who's a physical therapist, Sherrick, and I said, hey, this is what I'm trying to do. What do you think? And he said, well, we've got this Resimax Mini that would be a perfect fit, and you can control it with your phone if you want to.
Yeah.
Anyway, so
Excellent.
the combination is just outstanding. And I have to say, because you kind of touched on something important too, as chiropractors, this is a very physical job. And a lot of us will see a lot of patients for many years. I'd say close to almost half of the tables I've sold so far in 2.5 months are to chiropractors. And
Interesting.
yeah, it's interesting because at first
Yeah.
I thought, well, maybe they want to test it out, and see if that's something they want to recommend. And I think that's part of the case. But I've talked to some of them, and they're actually getting it for themselves. And
Yeah.
this is my
Yeah.
story.
That's smart.
I needed that for myself at home because even though we have spinal decompression in the office, by the time the day's over, if I don't go home right away, I don't get to see my kids before they go to bed. Even though I needed to decompress, I didn't have the time to do it in my office. I wanted something at home for after the kids were asleep, or maybe first thing in the morning before I go into the office. And I've done all of my spinal decompression on myself. I'd say 95 to plus percent of it at home with my home devices. And I used to have chronic low back pain for decades. And I have not had it in many years, probably I'd say over 5 years. I just don't have back pain anymore. So for me now, home decompression is just a matter of maintenance. I don't do it as often as
Sure.
I had to before, but I do it to preserve the disc. And I do have a question for you. I think that's really important. I've heard different things, and I don't know that anyone truly has the real answer. But initially when we decompress, it's really incredible. You said prophylactic effect before. It reduces pain at some point. But can we really use pain to know when the disc is fully healed? Does it take longer for a disc to completely heal at its best than it does for the pain to go away? Or is the timeline the same? And I have my answer, but I don't, it's based on my own experience. Um, I'm just curious to know, based on what you've seen, what you think.
So I like to think that when you're starting slow, it's actually like a snowball effect. So I would tell my patients, because you know how some patients are, you sell them, say, a 20 visit package at 10, they're not feeling better, so they're gonna want to quit or want to refund. And I say, you got to understand something. This treatment is heavy on the end. In other words, we're gonna start you real slow. You may not even feel the pull. Okay. Now think about it. As we get older, we lose what? Vibratory sense. If we lose vibratory sense, we're not going to feel that pull. There are elderly people that never felt that machine move, but then when you look at it, you can see that it's separated quite a bit. It's just that they've lost their vibration sense. So I tell people we start you slow because it's a snowball effect. In other words, the 10th visit's not like the third visit. The 12th visit is not like the sixth visit. Once you get the 10, 11, 12, that's when it's the work's really happening. And that mechanism is going to continue even when they're done with care. So in my thought, because my thought, I charge 3,500 bucks, people would be done and they're like, dude, I feel 50% better. Well, then I would offer a maintenance package to try to get them another 25% better, but maybe they don't want to spend the money because it's outside of their price because they've already spent thousands of dollars. But now you can offer them an at-home unit,
Mhm.
very affordable. I'm sorry, if someone can spend $3,000 or $4,000, they can afford another $1,000 for at-home equipment that they're going
Mhm.
to have for the rest of their life. So that's the way I explained that. And I hope I
Yeah.
answered it okay.
Yeah, that helped a lot. And part of where I was going with that is one thing you said I thought was really great is once you've done that initial amount of decompression, then the healing is going to continue because they're going to move now.
Yes.
As they move around, they're not going to lock down that area. They're not going to guard it as much. And the movement from their walking, their bending, their daily activities is going to be beneficial to them. So thank you for answering that part. But how long does it take for a disc to heal completely? Can it truly heal in weeks, or is it something that takes a year or more? And I know this is different from person to person, but
Yeah.
I've been looking for, for research on that topic and concrete
I
answers, and
don't
it's hard to
I
find
don't
them.
think you can find it. So again, me doing it for the number of years that I've done it, this is what I've seen. And listen, I can speak from experience because I had an 8 millimeter disc and and my knee was hurting. And here I am a doctor and I'm getting MRIs on my knee and all that. It wasn't my knee, it was my low back. Not only that, I have facet tropism on my left side. So I do get a flare up every once in a while. But when I did my post MRI, that disc was gone. I've seen that personally. So this is what I explain to my patient. Look, the whole theory with decompression is get that disc to go back to normal. But
So
does
you're
that
saying
really
you had an
happen?
8 millimeter
Eight
uh,
millimeter
herniation,
protrusion.
protrusion?
Yes,
Okay, and
yes.
that fully
And it
retracted.
went away. And it went
Okay.
away. Because when decompression was first sold to us, they said that it's going to get the disc to move back in. Well, doing it for a number of years, I realized, well, that only happens maybe 50% of the time. Now I could get rid of pain 80% of the time, but as far as getting that disc to go back, about 50% of the time. It doesn't matter as long as they're feeling better, right? And this
Mhm.
is what I explained. If they're feeling better, they're going to do more motion, they're going to do more exercise, more movement. That alone is going to help with their pain. If we're just sitting around isolated in bed all day, of course we're going to be a lot more sensitive to pain.
Yeah,
Okay.
absolutely. Yeah, and that's a really good point too. It's important to start moving again because a lot of times when you're hurt, naturally you want to avoid movement, but
Exactly.
it's important to
Well,
encourage
well,
activity.
think about it.
Yeah.
Think about it. If I got that lady that was in a wheelchair, Obviously, her maps are going to be impaired. Her maps are used to her being in a wheelchair. Well, when I get her out of enough pain to walk with a walker, her maps are going to be restored, hopefully, and she's going to be moving. And anytime she's going to be moving more, it's going to help inhibit that pain process. So that's kind of how it works.
Hmm.
And the best part is, I think it's the safest thing. I think it's safer than an adjustment because I mean it just is. I've never really heard anybody. I've had maybe twice in 20 plus years of somebody go, oh my God, oh, and they will you get spasms sometimes, but I like to think the antidote was hooking it up to E-stem while they're doing the decompression. And really, I don't even think I had that experience since I did that.
Hmm.
But I don't think it's anything to be afraid of. The second leading cause of people going to the doctor is back pain. What's nice about decompression is now it's well accepted because towards the end, I was getting referrals from medical doctors. Heck, I was treating medical doctors.
Our audience is a mix of doctors and
Mm-hmm.
patients, people who are in pain. And
Sure.
again, we're all human, and 80% of us are gonna have back pain at some point, so it's
Oh,
just
yeah.
things that's it's good to understand. So you've done a phenomenal job at explaining it from your perspective, and I thank you for that. I do want to quickly highlight a couple things. One is if someone's watching this and they want to get a system, we are going to post a discount code on there. But for
Awesome.
doctors who are really intrigued, because you and I have been doing this a long time, you've been doing this longer than I, and you're also teaching other clinicians how to do this well. If there's doctors that are hearing this and they want to reach out to you and they want to get more of your expertise, maybe some of your training, what would you say is the best, how's the best way for them to reach you? Is there an email that you want to post or a website or
Yeah, my website for the consulting is the Kalapp Method, and Kalapp is Kallapp, and it's just the KalappMethod.com. And then it's got my website, nothing fancy. I think I'm really good at teaching offices how to get cash because, people think, oh, it's scary to ask people for cash. But I'm like, but you're not getting paid with insurance. So you're going to have to need to know how to communicate and get people to pay. And as long as you verbalize everything correctly, people will pay. People get that. They know their insurance isn't going to fix their back necessarily unless they're going to get a $160,000 surgery. Okay. Let me back up to this is important. I don't want to forget this because people often ask me, what do you not pull? I already said cancers, blood clots, things of that nature. What about post-surgical? You can't pull a fusion. If they have metal, even if they have cadaver. So say they have L3, L4, L4, L5, but L5S1 is not fused. Can you decompress it? You can't. And do I agree? No, I don't, because if it was my brother who wouldn't sue me, I would. Okay. But what do I mean by that? Because all it takes is for something to happen that had nothing to do with you, and a screw comes undone or some weird phenomena, then they're going to come at you and say, you pulled them. And it didn't cause it because it's too gentle, but they're going to blame you. So don't go there. And some guys do because they need the money and all that, but I'm like, you can't do it. What about post laminectomy? Listen, this is where I thought we had great success. Post surgical, as long as it's not a fusion, does fantastic with decompression. Why? Because a lot of their pain is from adhesions, scar tissue in the area. So I always found that decompression does really good with scar tissue. And scar tissue, when it develops, those pain receptors start growing in the scar tissue. So when you start breaking up the scar tissue, and it sounds painful, but it's not. Those people do really well. So I've had a lot of success with post-laminectomy or microdiscectomies and all that stuff. So don't be afraid of those. Those people do really, really well. Okay.
outstanding.
All right.
All
Yeah.
right. Well, thank you, and appreciate your time very much. I'll
Dr. Noel, it's a blessing, man. You're a blessing to the profession, my friend. And if
yeah,
anybody needs anything, look, I'm not going to charge you to call me. Just ask questions. I'm friends with everybody. Whatever you guys need, I'm here to help. All right.
outstanding. Thank you.